for child welfare agencies to bill federal 4E dollars for a model of care that is emerging from the Family First Prevention Services Act that is called a Qualified Residential Treatment Program. And some of the guidance that is coming down from the Federal Children's Bureau really showed us that there may need to be some updates to the Nevada revised statutes, and that is to align with that guidance to provide that path. I do want to say a few things with respect to our intent and plans forward, that we are working with the state DCFS, the Department of Welfare and Supportive Services, because there are quite a few moving parts with respect to how we are going to license this part, with Clark County and with Washoe County and any stakeholders whom the state will designate on this bill. We intend to bring you a consensus product, really, to say that to move us forward to provide this path. It's tremendously important for Clark County because the federal guidance states that we will no longer be able to bill 4E dollars for this group home kind of model of care unless beyond 14 days, unless we have certain exceptions, one of which is this Qualified Residential Treatment Program, which the federal guidance also tells us needs to be licensed by the state as a child care institution. And our definition in Nevada did not match the federal guidance, and that's the intent of the BDR. So I wanted to say that we will work with our child welfare agency colleagues and our state colleagues on this bill, and want to thank you for including it today for action, and ask for your support. Thank you.
Thank you so much, and we appreciate your commitment to continuing the work on this issue. Is there anyone else in Carson City who would like to come up for public comment? Seeing none, I'll go ahead and ask BPS if they can check the public comment line for folks calling in for public comment.
Thank you, Chair. If you would like to offer public comment on today's meeting, please press *9 now to take your place in the queue. Once more, that's *9 now to take your place in the meeting to offer public comment.
Good morning, Chair Peters, Vice Chair Joniate, and members of the committee. My name is Jimmy Lau, first name Jimmy, last name Lau, Lau. I'm the Vice President of Ferrari Reader Public Affairs, representing Dignity Health St. Rose Dominican. On behalf of St. Rose's nonprofit acute care hospital system in Nevada, we want to thank the committee for its diligent work this interim and offer comments in support of 2 items on the committee's work session document. First, we'd like to offer our support for item L, specifically the creation of a public health infrastructure and improvement account. This item will provide ongoing support for Nevada's public health infrastructure, complementing the work of community stakeholders across our state. St. Rose is proud to be a part of Nevada's public health infrastructure, offering many free and low-cost programs through its foundation and wellness centers to address social determinants of health for Nevada's most vulnerable and disadvantaged residents. Second, we would like to offer our support for item K related to community health workers. St. Rose has supported legislation in previous sessions related to community health workers, recognizing the substantial value they provide to the communities they serve. Expanding access to community health workers will provide an immense benefit to Nevada's residents. We are hopeful this revision to the existing statutory authorization for community health workers will allow St. Rose to bolster its work in providing high quality and accessible services for Nevadans. We look forward to working with the legislature on these measures in 2023. Thank you for your time and consideration.
Thank you for the public comment. Are there other folks on the public comment line?
Good morning, Chair Peters and members of the committee. My name is Megan Kamwasi, and I am the Associate Director of the Center for Public Health Excellence within the School of Public Health at UNR. First, I want to thank Senator Joniate for all the time and work he and staff put into the SB 209 study. Through it, he received a significant amount of feedback, the results of which are reflected in the work session today. For many, the COVID-19 pandemic provided the first concrete example of what the public health sector does and underscored the importance of robust public health systems. It also highlighted the consequences of chronic underfunding, workforce shortages, and outdated infrastructure, which limited the state's capacity to respond to public health challenges before the pandemic and exacerbated them during the crisis. The proposal before you in item L in the work session document regarding public health modernization represents a significant step toward improving the ability of public health practitioners to prevent and respond to health crises in the state. It's ongoing flexible funding that will be a perfect complement to the historic investment in public health infrastructure that the Interim Finance Committee approved yesterday. As you consider these proposals today, I think it's just important to remember that there are hardworking public health professionals who are currently stretched thin, who are doing the best that they can with the funding and the staff and the capacity that they have, and this non-categorical funding will just enable them to address whatever the public health issue is of the day and respond to the needs of the residents and the communities you serve. Thank you for your time.
Thank you for the public comment. Are there other folks on the public comment line?
Yes, Chair. One moment. If you would like to offer public comment for today's meeting, please press star 9 now to take your place in the queue over the phone or raise hand inside the Zoom client. Once more, that's star 9 now over the phone or raise hand inside the Zoom client to participate in public comment.
Good morning, Chair Peters and the rest of the committee. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. I echo the prior speakers, and we do support item L and K, and thank you so much for your valuable time. Take care.
Thank you so much for your comment. Are there other folks on the public comment line?
Hello, this is Jay Colbeck-Clausel, for the record, from the Nevada Community Health Worker Association. Thank you, Chair Peters and members of the committee for having us today. I will be available to answer questions when item K comes up. But on behalf of the CHW Association, please consider a one-word addition to the recommendation. CHW is a very broad title, and there are CHWs who do not have certification and have staff funding sources that do not require it. Employers have been supporting their staff to pursue the requirements, and we believe that this should be left to market forces to reward CHWs and employers who pursue training and certification. The FQHCs and MCOs are strong advocates for CHW education and certification, so we've seen many of their staff come through our classes even before it was a requirement. Medicaid reimbursement will require CHW certification, and that requirement is appropriate. So with all that in mind, the one-word addition is to add the word certified, so holding himself or herself out as a certified community health worker in this state before, be certified as a community health worker by the Nevada Certification Board. And I'll repeat that since I fumbled. So require that any person holding himself or herself out as a certified community health worker in this state be certified as a community health worker by the Nevada Certification Board. Thank you very much for your time.
Thank you so much for those public comments. I made notes on that suggestion. Are there other callers for public comment?
Thank you, Chair. The public line is open and working. However, there are no other callers wishing to offer public comment at this time. Oh,
Thank you so much.
Excuse me, Chair. Sorry, one person did just raise their hand.
Okay, please go ahead and add them.
I'm sorry, I was muted. Good morning, Chair Peters. This is Kevin Dick. I'm the health officer for the Washoe County Health District. And I want to comment on the public health modernization in item L. We saw the consequences of underfunding of our public health infrastructure during COVID-19. And I'm sorry. We saw the underfunding of public health and the impacts during COVID-19. We had health inequities that were magnified, and disadvantaged populations were severely affected. The lack of resources to work with the disadvantaged communities on inequities and health priorities prior to the pandemic left us ill-equipped to work with these communities to provide the support and access to services.
Mr. Dick, we lost you a little bit there. You're quite muffled. Mr. Dick, we cannot.
Nobody can hear him.
Federal funding to visit medical offices, work with physicians and nurses in our community, help them and their staff to understand how to properly store and administer vaccines for children. All academic details. But for those nurses, while they're in those physicians' offices, they're not allowed to provide information on how to identify and properly test for monkeypox, because the categorical funding they receive can only be used for education, not childhood vaccines.
Can only be used for education. He's making that clear. They're just saying there's no flexibility in the use of these monies. They're trying to flip the money, that's all. Money. I think they're in a recess. No, they're still on. Yeah, thank you for blurring the screen because you took out my preferences, whatever. Because I know I have my settings saved. Where? Bugs. I can't believe this. Oh, that's what happened. Something simple.
But not weigh you, check your pulse and oxygen levels, or have you stick out your tongue and look down your throat. Categorical funding issues, chronic underfunding of public health, and urge you to approve CPR for public health modernization. Item L, to pass this legislation urgently.
Thank you for the public comment. We were having a hard time hearing, so hopefully you will submit those comments in writing to our staff so we can include those in the public record. BPS, is there anyone else waiting in the public comment line?
Yes, Chair, there is one other caller.
There's another caller. Let's hear it. 14 days. They got 14 days to fix, the programs that they're serving these children in the foster care because they're not considered residential treatment centers. No, they're not. Oh, they're paying them. We'll see how well they're doing.
BPS, we are not hearing anybody coming in through the speakers Is it possible that the caller is still muted?
Hi, good
Sorry,
morning,
we'll
Chair
wait.
Peters, and
Please go ahead.
can you hear me okay? Thank you. Apologies. Thank you for the opportunity to comment on the proposed Public Health Infrastructure and Improvement Fund under item N in the work session document. I am Andrea Gregg, Chief Executive Officer for High Sierra Area Health Education Center, also known as AHEC for the record. I'm a proud alumnus of the University of Nevada, Reno School of Public Health and have spent the last 15 years leading an organization that serves as a critical convener between academic, employer, and community-based partners to really focus on the development, diversity, and distribution of our state's healthcare and public health workforce. We know now more than ever that a sound and sustainable public health infrastructure is an urgent matter for our state. The state's experience over the last 2 years has really demonstrated the need to invest in the public health workforce, as well as build for a future while ensuring that health outcomes improve over the longer term. Finally, the proposed funding and associated investment provides a real opportunity to diversify funding for public health programs in Nevada, which we know would really alleviate some of the reliance on federal financing, which could lead to the dismantling of programs after that funding has been exhausted if sustainability has not been able to be attained. So often the very restrictions that come with federal funding can often leave many of our most vulnerable communities without access to
because you guys
services,
are not doing the work.
therefore providing the opportunity
They're
for
not doing the work.
non-categorical and flexible funding will really ensure fundamental public health services are
I don't
in
think
place
so.
and can certainly respond to current and emergent public health needs, as well as improve the health of all communities in Nevada. And then finally, on behalf of our organization, I also echo some of my colleagues on the line and also would like to submit our support for the
Not-for-profit.
community health workers, as we know that investments there will also improve our healthcare impact and outcomes overall. Thank you.
Thank you for the comment. BPS, are there other callers on the public comment line?
Are there other callers? I don't think so. Nobody ever knows what you guys are doing. However, I understood that 14-day warning.
Yes, Chair, there is one caller with their hand raised. However, they are not responsive. Would you like me to make a note next to their name and we can come back to them during the second public comment?
Yeah, it looks like there's someone in Carson for a public comment that I'm going to go back to as well. So if they do end up responding to you, I'll come back to you after Carson and we'll see if we can get them in this first round. I'm going to go ahead and go down to Carson City. Please state your name for the record and proceed when you're ready.
Good morning, Chair Peters and Interim Health Committee. For the record, my name is Joelle Gutman Dodson, and I'm the Government Affairs Liaison for the Washoe County Health District. Kevin Dick, the Health Officer of Washoe County Health District, was on the phone, but you guys were having trouble hearing him, so I will read what he would have liked to have said into the record. So we're here in support of the Public Health Infrastructure and Improvement Fund. The Public Health Improvement Fund that we've been working on for several sessions now is desperately in need after so many years of underfunding of our public health agencies. We saw the dire consequences of this during the COVID-19 pandemic. Health inequities were magnified and disadvantaged populations were the most severely affected. The lack of resources to work with these communities historically on inequities and health priorities identified in our public health needs assessment left us ill-equipped to work with these communities to provide the support and access to services they so desperately needed. And as you know, we are always at risk of a new public health crisis or emergency. Right now we are facing monkeypox and again are hindered by the lack of adequate and flexible public health funding. I wanted to give you a couple examples. We have a federal funding grant right now to administer COVID-19 vaccines to respond to that emergency, but we are not allowed to use those funds to administer monkeypox vaccines or even to assist callers to our call center seeking the monkeypox vaccine. We have federal funding to visit medical offices and work with physicians and nurses in our community to help them and their staff to understand how to properly store and administer vaccines for children. This is called academic detailing. But those same nurses, while they are in those physician offices, are not allowed to provide information and education on how to identify or properly test for monkeypox because the categorical funding they receive can only be used for education about childhood vaccines. The current funding system we operate in is ineffective and unsuitable for meeting our public health responsibilities. It's like going to a doctor who could take your temperature but not weigh you, check your pulse and oxygen levels, or have you stick your tongue out and look down your throat, but not look at your ears. We need to fix this categorical funding issue and the chronic underfunding of public health. Thank you.
Thank you for those comments. BPS, were you able to connect with that other caller?
Yes, Chair, they are connected and unmuted. Caller with the last 3 digits, 237, you may begin.
Thank you, Madam Chair and members of the committee. My name is Marlene Lockard, and I represent FEIU 1107, the largest union of healthcare and public workers in Nevada. Thank you for this opportunity to report on the progress of SB 340, approved last session. I am pleased to report that the committee is operating as intended for the first time in the state's history. This legislation has brought together representatives of home care providers, recipients, and employees to discuss and find solutions for the myriad of issues that have contributed to the low wages, poor working conditions, and the chronic shortage of home care workers in Nevada. Just about a year ago, the Gwen Center issued an assessment of the personal care workforce in Nevada, reporting that a dire crisis was on the horizon, creating a dangerous home care worker shortage, which will hurt Nevada seniors, people with disabilities, and home care workers alike. To compound an already simmering public policy time bomb, Elders Count indicates Nevada has been and will continue to experience an aging tsunami. Nevada's population has increased by more than 11.42%, while the 65 and older population increased by 40%. Nevada's growth rate for age 85 and older is double the national rate. There are approximately 13,000 personal care aides to assist elderly and physically disabled Nevadans with the daily living tasks, such as bathing, eating, toileting, and mobility in their clients' homes. This workforce is disproportionately women of color who are currently paid an average only of $11 an hour, with few to no benefit. Close to half of the workforce relies on some form of public assistance because of low wages and inconsistent hours. Home care workers play a critical role in keeping seniors and adults with disabilities out of expensive and less desirable care settings. For example, Nevada saves an average of $70,000 a year for every senior who is served through the frail elderly home and community-based waiver program instead of a nursing facility. Despite the important role that home care workers play, which has been made all the more evident during the COVID pandemic, the home care industry suffers from over 50% turnover rate due to the lack of compensation and respect afforded to these women. Lastly, the vast majority of home care in Nevada and nationally is delivered through Medicaid. Most individuals needing care cannot afford to pay out of pocket. As such, the state, through its role of setting reimbursement rates and other Medicaid policies, is responsible for setting employment and working conditions for the home care industry at large. I would like to commend you and the 2021 legislature for having the foresight to enact legislation to immediately address these critical issues. And I am speaking to item M and asking for your support of the recommendations that have been adopted to date by the Workforce Employment Board. Deputy Administrator Cody Finney has been tasked to chair the Home Care Employment Standards Board, and I know she will be available to answer any other questions during that item. Thank you very much. I appreciate your time.
Thank you, Ms. Lockhart. We appreciate you calling in to give us a brief update on that, the status of that committee, and we look forward to hearing more about those recommendations in the coming session as well. Are there any other callers? I don't see anybody coming to the tables. BPS, do we have anyone else on the public comment line?
No, Chair, the public line is open and working. However, there are no other callers wishing to offer public comment at this time.
Thank you. Thank you so much. We'll go ahead and close out that first public comment. Thank you for all of those who provided public comment. We appreciate you being here today with us. We'll move ahead on to agenda item 3, approval of meeting minutes for the meeting on May 19th, 2022. Members of the committee, are there any questions regarding these minutes? Seeing none, I will entertain a motion to approve the minutes of the committee meeting on May 19th, 2022. I have a motion from Senator Doñate, Vice Chair Doñate. Do I have a second from Senator Harris? Are there any comments or discussion on the motion before we vote? All in favor, please say aye or raise your hand. Aye. Any opposed? Thank you. The motion carries with those present. We'll close out agenda item 3 and move on to agenda item 4, consideration of regulations proposed or adopted by certain licensing boards pursuant to NRS 439B.225. I'm going to go ahead and ask staff to go through these for us as listed in the agenda. I just want to remind the committee, though, that this is informational only. Staff has informed you about the status of the regulatory process of the regulations that we are now considering. If you have a greater interest in participating in the development of these regulations, the process can be found on the LCB website, or you can reach out to our staff for additional assistance. Committee review is an important process for follow-up on bills that we have passed in the last couple of sessions, but we will not be taking any action on these items today. I want to note this committee neither approves nor denies any of the regulations before you today. Instead, each board adopts its own regulations followed by approval through the Legislative Commission. The HHS committee's consideration of these regulations is only from an advisory perspective. If you need further detail, you can please reach out to LCB staff or those boards, regulatory boards. Okay, I'm going to go ahead and ask Mr. Robbins to go through the list of regulations for consideration today.
Yes, Eric Robbins for the record from LCB Legal. So there are 6 regulations that the committee is considering today. There is LCB file RO10-22 and LCB file RO94-22, both of the State Board of Health. There's R026-22, which is being considered by the State Board of Oriental Medicine. There is R057-22 of the Board of Examiners for Marriage and Family Therapists and Clinical Professional Counselors. And lastly, 2 regulations of the State Board of Pharmacy, R085-22 and R086-22. I believe we have representatives of each agency available if members of the committee have questions on the regulations.
Thank you so much, Mr. Robbins. Is there anybody who has questions on the committee on these regulations? I believe Dr. Titus does. Please go ahead.
Thank you, Madam Chair. I appreciate the opportunity to ask a brief question on, and this is in regards to R010-22 of the State Board of Health, and I was just wondering the penalty fees, wondering how they were set if someone doesn't report. This is regarding the cancer reporting.
Hi, this is Andrea Oguchi. I am the program manager for the Nevada Central Cancer Registry. And that these were actually just a clarification to
what is already currently in regulation. So working with our stakeholders, including the Nevada Hospital Association and the Nevada Rural Health Partners, we realized that there was quite a bit of confusion as to what those fees were, because we also have in regulations an abstract fee that was placed there, prior to even looking to amend these regulations.
Okay, thank you. Because again, there's a fee for not reporting, but then there's a fee when you report, and just per facility, I just need some clarification. So thank you. I have no further questions on that particular one, unless somebody else does.
Are there any other questions for the State Board of Health?
I have another question on one of the other regs.
On the second set, go ahead, please.
Correct.
Please ask.
So this is on 09422 on the music therapy, and I'm just wondering why. Why is there an issue with this? Has it been abused? Why are we again regulating music therapy? And is it because they're billing for their services, so it requires some regulation and certification? I just think we have so many licenses that we require in our state. It's more of a hindrance to care than helpful care. So can you explain me just briefly perhaps why this was recommended? Where's the problem we're trying to solve?
Hi, this is Letitia Motherell, for the record. So the licensing of music therapists is actually a statutory requirement. So we have to license music therapists. NRS 640D.10010, the legislative declaration, notice that the practice of music therapy is hereby declared to be a learned allied health profession, and it's needed to protect the public from the practice of music therapy. So that's why we license them, because it's in statutes. We have no choice. As far as the regulations, Section 1 is a requirement due to NRS 622.087. That was AB 330 that I believe passed in the last legislative session that applied to
Okay, enough. What they do is they write legislation to attempt to meet the federal standards, and they never meet any of the federal standards. But, for people who are depending on those services, it's real. So what are we doing? I heard on the news, more and more African American children are being placed on homeschool. Not a bad idea, as long as you can find a homeschool provider. Know your rights. And failure is just not a part of the plan. So know that. It's always encouraging to understand that, failure is just not an option. But for those who accept failure, what can I say? Not a whole lot. It's kind of like why we're stuck, begging for what? George Floyd begged to hear his mother. We all knew she had already passed. I've never been a slave and don't know how to behave like one either. So the word is, e provision. Out of many, there's one. Out of one, there just may be none. But what are you doing in 2022? Like, subscribe. Find my podcast on Anchor. Parent Empowerment Hour. What the hell? Or find me on Wisdom. It's Darlene Anderson. Or Darlene Anderson 1958. Whatever. Just learn, go, and grow. Puppets. It's so sad. Everyone should consider removing their child from public education if public education is demonstrating that their child has no future. That's just real. Find a home provider, school provider, and find a choice of a career that you want to enter into, and then run like hell. That's what it is. Run. Because you sure can't hide. Y'all have a great evening.